Greetings of the day. I am Dr. Anusha and today I will be talking about circle of Willis and cerebral artery syndromes. Circle of Willis, it is an arterial circle that is present at the base of brain and around interpeduncular fossa. Circle of Willis, it is bounded anteriorly by anterior communicating artery, anterolaterally by anterior cerebral artery, and laterally by proximal part of internal carotid artery, posterolaterally by posterior communicating artery, and behind by posterior cerebral artery. The circle of Willis gives cortical as well as central branches. Central branches enter into the substance of brain and they supply to the basal ganglion, internal capsule and corpus striatum. Whereas cortical branches, they anastomose on the surface of the brain. So what happens when there is occlusion to the anterior, middle, posterior and internal carotid arteries? Anterior cerebral artery, it innervates most of the medial surface of cerebral cortex, whereas middle cerebral artery, it innervates most of the superolateral surface of the cerebral cortex, whereas posterior cerebral artery, it innervates most of the inferior surface of the cerebral cortex. While studying, you have to keep these things on mind. Anterior cerebral artery syndrome, it is due to occlusion of anterior cerebral artery. Anterior cerebral artery, it will be mainly supplying to the supromedial part of cerebral cortex, and functional areas that are present on the medial surface of cerebral hemisphere will be mostly affected. Symptoms what we see in cerebral artery syndrome are contralateral leg weakness and contralateral sensory loss. These are due to involvement of primary motor area and primary sensory area. Primary sensory area is area number 312 and primary motor area is area number 4. And there will be variable degree of frontal lobe symptoms, and prefrontal area is area number 9 to 12. The function of prefrontal area is tactful thinking, judgment, mature thinking. When there is occlusion in the anterior cerebral artery, prefrontal area will be affected, and symptoms what appear are apraxia, ebulia and impaired judgment. Because paracentral lobule is involved, there will be incontinence. Posterior cerebral artery syndrome, it is due to occlusion of posterior cerebral artery. Posterior cerebral artery, it mainly supplies to the inferior part of cerebral cortex. Calcarine branch of posterior cerebral artery, it supplies the visual area and visual association area, that is area number 17 and 18. In occlusion of calcarine branch of posterior cerebral artery, there will be contralateral homonymous hemianopia with macular sparing. There is macular sparing because there is anastomosis between the cortical branches of posterior and middle cerebral arteries. What are the other symptoms we see are diplopia, dizziness, dysphagia, dysarthria and drop effect. This dysphagia is due to the damage to the supranuclear lesions that are involved in the speech pathway. If thalamus is involved, there will be contralateral hemiparesis or hemisensory loss and ataxia. Middle cerebral artery syndrome is due to occlusion of middle cerebral artery. Middle cerebral artery mainly supplies the superolateral part of cerebral hemisphere, and symptoms will vary depending upon whether dominant hemisphere is involved or non-dominant hemisphere is involved. In case of dominant hemisphere, there will be right hemiparesis with involvement of face, upper limb and lower limb. Face and upper extremity are involved more when compared to lower extremity, because lower extremity is more involved in case of anterior cerebral artery occlusion. There will be right-sided sensory loss in a pattern similar to motor deficit. There will be decreased stereognosis, aphasia, alexia, agraphia, acalclia. All these are symptoms due to involvement of sensory speech area, that is area number 39, 40 and 22. In case of sensory speech area deficit, there will be word deafness and word blindness. What is word deafness? Patient is unable to interpret what we are saying, that is word deafness. In case of word blindness, patient is not able to interpret what we are writing, that is word blindness. Because of these things, there will be alexia, agraphia and acalclia. And in case of right hemisphere, there will be left hemiparesis, left-sided sensory loss similar to motor deficit, left homonymous hemianopia, dysarthria, anosognosia, asymptoagnosia, prosody of speech, and flat effect. Thank you.